Welcome to Pedicab's PDS Express short concepts. So today we'll be discussing dilaceration. Now this dilaceration, it is important for your viva and also for your short note. Now before starting, let me tell you that if you have not subscribed to our channel, please do subscribe and hit the bell icon. So whenever we just discuss this type of short concept or any question or any quiz we are discussing, you'll just get notified, right? So let's start with the topic dilaceration. Now you might have read this term in your oral pathology and oral medicine. So this topic, it is important for your oral pathology and oral medicine as well. Now you would have read about the developmental disturbances of the teeth. Now developmental disturbances of the teeth, it could be in the shape of, it could be in the form of number of the teeth first. Second, size of the teeth, shape of the teeth. Then fourth is structure of the teeth. So that's a huge topic and we'll be covering in parts. So in number, it could be anodontia, supernumerary teeth, anything. Then size, it could be microdontia and macrodontia. Then in shape, it could be dilaceration, concrescence, and this taurodontism and many other things. And the structure, it would be dentinogenesis imperfecta, amelogenesis imperfecta. So today we'll be discussing one thing, that is dilaceration. Now, what is dilaceration? Now, by the image, you would be having some idea that what is dilaceration. Normally, root has to be like this, but here you can see that it is bent. Similarly here, okay. So this is dilaceration, and dilaceration means deviation or bend in the linear relationship of the tooth crown to its root. So here you can see that this is the long axis of the tooth and this root, it is bent like this. Now it can be diagnosed with a simple radiograph of the affected teeth. So before going into that thing, radiographic diagnosis and all those things, let me tell you the dilaceration, it is more common in females as compared to males, and it is seen in central incisors and lateral incisor, though you can see it any of the tooth, but most common tooth, the affected tooth, it is central incisor and lateral incisor. Now all these questions, they are important for your viva, that's why I'm telling. Now next thing is that which dentition is affected more by dilaceration. So it is permanent dentition which is more commonly affected for this dilaceration, right? Now here also in this radiograph, you can see how these roots, they are bent, not this one, but this molar. Now the question arises, why it occurs? What is the reason? Again, this thing is important for your viva. Examiner will ask you, what is dilaceration, and if you just tell what exactly dilaceration is, they'll be more interested to know whether you know the etiology. Okay, so etiology, the basic etiology is the trauma, though they say that it is idiopathic, but the etiology is trauma. Now this condition, it is thought to be due to trauma or possibly a delay in the tooth eruption related to the bone remodeling gradient during the period in which the tooth is forming. So whenever any tooth is forming, whenever your permanent dentition is forming, if you met with any trauma, what will happen? The tooth will get affected and the remainder of the tooth will develop at that angle only. So it results that the position of the calcified portion of the tooth is changed and the remainder of the tooth is formed at an angle. So this is the reason why there is bend in this root. Okay, now examiner can ask you the sign and symptom. As such, patient will not have any sign and symptoms related to this dilaceration. At times they can say that they might feel pain, sensation, numbness in that region, but apart from this, there are no such sign and symptoms related to this. And epidemiology, I have already told that females are more affected as compared to the males, and the ratio is 1:6. And this is female and this is male ratio. Central incisor and lateral incisors, they are most commonly affected. Now the question arises, why are we even reading if there is no sign and symptoms? But the thing is, whenever you are doing RCT, that is root canal treatment you are doing, or you are extracting the teeth, at that time it could be a problem. Suppose you are without taking IOPR, you advise a patient to go for extraction or root canal treatment. what will happen whenever you'll just start extracting this tooth, this part will come out, but this will uh, remain in the jaw itself. So it is advised whenever you are just going for extraction, you need to take these IOPRs to confirm the bone, to confirm the root structure. Okay, so the complication, it could be in RCTs and extraction. Now again, one more thing, I'm just reminding that you have to subscribe these channel if you want to get updated about these all these lectures, short concept. And apart from that, you can even go to these Medico apps, www.medicoapps.org/groups. Now these are groups, and we'll be notifying in these groups about these lectures, and it is according to the year. So if you are first year student, we'll be just notifying first year related videos. If you're second year student, we'll be just uploading the second year videos for these groups. So better you just subscribe these channels and hit the bell icon, so whenever we are subscribing, whenever we are just uploading any new videos, you'll just get notified. So these are the short concepts on which questions can be asked, especially the short note, and we'll be telling what all is important for your Viva. I hope you like the class. So in next class, we'll be discussing some other anomaly, and we'll be even discussing some other topic from the other subjects as well. Hope you like the class. Thank you.